Cancer is one of the biggest health crises in the Philippines, posing a major burden on both individuals and the healthcare system. Join me as I take you inside the journey of the patients, families, and the first hospital that is redefining cancer care in the country. Every year, over 150,000 new cases of cancer are diagnosed in the Philippines, often in advanced stages, leaving families grappling not only with fear, but with financial hardship as well. Nakilala ko ang mag-inang cancer warriors na sina Aling Fe at anak niyang si Lexter. Ibinahagi nila ang kanilang matapang na pagharap sa hamon ng sakit na cancer. Kwento ni Lexter panahon ng pandemya nang siya ay makaramdam ng kakaibang sakit sa kanyang kaliwang dibdib.
After the ultrasound, lumabas BIRAD 5. It means malignant na. So, I don't have any idea about it, kung ano yung BIRAD 5, whatever. So, I think about it kung paano ko siyang i-relate kay nanay. Kasi for sure, sinabi ko, nay, may cancer ako, hindi naman yun. Baka mamaya siya high blood, inatake or what. So, iniisip ko, okay, paano ko siya isi-stage, kumbaga na, huwag kang mag-alala. Everything will be okay.
Dagdag pa ni Lexter kahit pilit niyang ipinaparamdam sa kanyang ina na huwag mag-alala, hindi pa rin mapanatag ang kanyang loob. Lalo na nang malaman niya na mahigit 2 milyong piso ang kakailanganin para ipagamot ang sarili. Hindi biro ang kanyang pinagdaanan dahil mag-isa niyang nilabanan ang kanyang karamdaman.
Tiniis ko yun. Mahirap, of course. Mahirap talaga siya. Kasi hindi ko sinasali si nanay sa lahat ng check-up. I don't want her to get stressed.
Dagdag ni Lexter, dahil wala naman siyang ibang makakatulong sa gastusin, wala siyang kalayaang pumili ng ospital.
Hindi ka na makapili eh. Magandang hospital, pangit na hospital, importante gagaling ka. Hindi ko na tinanong ko baga na bakit nangyari sa akin to? Bakit ako yung may, questions like that.
So hindi pumasok sa isip?
Hindi ko pumasok sa isip ko. Even sometimes my faith, I don't ask na why? Bakit ako?
Bakit? Bakit ganun ang...
For me, siguro, medyo malakas yung faith ko na binigay sa'yo dahil kaya mo.
Hindi pa man tapos ang laban ni Lexter sa kanyang sakit na cancer, nitong Hulyo lamang na kumpirmang ang kanyang ina na si Fe ay may sakit namang rectal cancer.
Paano niyo nalaman na meron po kayo sakit?
Parang hirap na ako magdumi.
Opo.
Tapos, tinitiis ko. Tapos, hindi ko na tiis talaga. Sinabi ko sa kanya na, bakit hindi na ako makapopo? Siguro mag-diet na lang ako. Nag-diet nga ako, hindi na ako kumakain.
Kwento ni Nanay Fe, dahil hindi tumigil ang kanyang pagdudumi na may kasamang dugo, siya ay napilitan ng magpa-colonoscopy.
So, nung pinatawag ako, sabi ng doctor, hindi na makapasok yung device, papuntang colon. As in, nakabara. Sabi niya, it's cancer. Colon cancer. So, sabi ko, paano pa kaya yung secret na hindi ako ma-stress? After mo pagdaanan, hindi pa ako tapos, and then, si nanay naman. But
So, ano nag-reaction mo nun when you found out?
So, kinumpos ko lang yung sarili ko. Okay, kung kinaya ko, kakayanin din to ni nanay. And the good thing is, I know what to do.
Yeah.
Kasi napagdaanan ko na.
Sa kabila ng mabigat na problema at doble-dobleng sakit na nararamdaman ni Lexter, di na rin niya naiwasang minsang magtanong sa itaas.
Yung sa kanya na, doon ako na medyo nag-question ng konti na sana ako na lang. Sana, kasi feeling ko kaya ko eh. Alam kong kakayanin ko. Mas bata ako. I mean, malakas ako. Pero sa kanya kasi hindi eh. And yung power of ito, sometimes, even you're sick, mas malakas to eh.
Yes.
Dumating na lang si Lexter sa punto na buong buo niyang tinanggap ang kapalaran nilang mag-ina.
Sabi ko, siguro it's really meant for me dahil I'm stronger than others.
Mahirap man ang pinagdaanan ni Lexter sa kanyang laban, malaki naman ang pasasalamat niya na natagpuan niya ang isang pagamutan na malaki ang maitutulong sa pagaling ng kanyang ina. On November 24, 2023, the country's first specialty cancer hospital opened its doors. The Healthway Cancer Care Hospital was built by Ayala Healthcare Holdings Incorporated, or AC Health, through the Healthway Medical Network. Healthway Medical Network President and CEO Jimmy Ismael said that from the start, AC Health envisioned building a hospital, one that would address an underserved disease area. That vision eventually became a specialty hospital for cancer patients.
So our vision is really to provide accessible, affordable, and quality healthcare to more Filipinos. In fact, our principle that we are trying to implement at the cancer hospital is change the way cancer care is delivered.
How many doctors?
Healthway Cancer Care Hospital Chief Operating Officer Dr. Rami Rojas also shared that many patients believe cancer is an illness only the rich can afford to treat. This is why HCCH was built, to ease not only the medical but also the financial burden brought about by cancer.
Again, to reiterate, we are here for the broad segment of Filipinos and basically the middle class. And so we understand how the middle class, what the middle class goes through in terms of finances. And by being a cancer specialty hospital, it also allows us to focus on the financial issues of our patients.
Healthway Medical Network CEO and President Jimmy Ismael explained that this is made possible through AC Health's pharma ventures. With its wide pharmacy network and partnerships, Healthway is able to provide affordable medicines to cancer patients nationwide.
On top of that, so they are able to bring in generic drugs, biosimilars, that reduces the cost of medicines that we can now offer to all of our provider clinics and hospitals.
Ismael says that aside from helping their patients with their financial concerns, they also made sure that the facilities in the cancer hospital respond to the patient's needs, ensuring a comfortable and relaxing experience throughout their care journey.
Yeah, patient navigation is important because normally, again, cancer patients go through different types of doctors. So it's important that there's a unified treatment plan, holistic, and that they're navigated through the process.
Like a concierge, they make sure every patient knows the next steps, the treatments to prepare for, and where to find the right support. Healthway Cancer Care Hospital has also introduced novel concepts to make cancer treatment more comforting.
We also have a healing garden that we have introduced for patients who have been confined or will be confined. We believe that having that option will accelerate the process of healing and enable them to actually feel much better or faster.
Even the smallest details such as uplifting signages and paintings created by the doctors, as well as by billionaire and art enthusiast Jaime Zobel de Ayala himself, they are carefully designed to help ease the patient's anxiety. Patients like Mommy Fe and Lexter are truly grateful to have personally experienced the excellent service and compassionate care at Healthway Cancer Care Hospital.
Anong ginhawa ho yung inyong naranasan dito po sa ospital na ito?
Sobrang ginhawa ang naranasan ko dito sa ospital. Kaya maraming pagpasalamat ko dito sa mga doktor kasi grabe ang kung anong naramdaman ko, tinitext lang niya ang doktor, sumasagot agad. Nung ang anak ko pa nagkasakit, sabi ko, Lord, huwag mo na akong bigyan ng sakit kasi alagaan ko. Nagulat lang ako nga itong year na to, may sakit ako. Kaya gusto kong umiyak na harap niya, hindi ako makaiyak. Kaya sobrang sakit sa dibdib. At malaking pasalamat ko nga nakapunta kami dito sa ito. Kasi talagang wala kaming pera. Siya lang talaga nag-support sa akin.
I'm so thankful na nabuo tong facility na to kasi kung wala, ewan ko na lang, hindi ko na alam.
Kwento ni Lexter, wala siyang binayaran sa ospital
And you're
para
staying where?
mapagamot si Nanay Fe.
So, yung finances, it's really helpful. Nakakatanggal yon ng anxiety, una sa lahat. Kasi talagang, nung ni-roll out nila sa akin na, okay, it's covered by PhilHealth, talagang napasabi ako dun sa nurse, Oh my God, this is the best hospital ever.
Pero dito, nung kay mami, wala kayong binayaran?
Wala. Kasi I have IntelliCare. So, ang remaining 17,000, na-cover siya ng IntelliCare.
Healthway Cancer Care Hospital is definitely more than a building. It is a promise that world-class care can be within reach, that no Filipino should face cancer alone, and that life, even with cancer, can go on with dignity, hope, and healing.
But we also have a very unique department called the Department of Quality of Life.
Yung Healthway became a safe space talaga po.
Only treatment, but comfort, guidance, and compassion too. Isa si Den sa mga pasyente na nakaramdam ng matinding takot nang malaman niyang siya ay may breast cancer.
So at first, akala ko kasi pagka sa ating mga babae, pag may menstruation tayo, medyo nakakapa natin yung lymph nodes natin. Usual naman yan. Kaya lang yung sa akin, parang after a month, sumasakit siya. Pero intermittent yung sakit niya. Pawala-wala. Ayoko may makaalam. Parang ayoko po yung pakiramdam na kakaawaan po ako. At the same time, mababurden po yung mga kakilala po namin. Yun po talaga. So, for 4 months, parang ilang months. Habang nag-work ako, tumawag yung friend ko, yung close friend ko na yun. And doon yan na binigay yung news na, then meron ng result. Tapos, sinend niya sa akin. So, binasa ko sa phone ko yung result. Basa ko invasive carcinoma, ductal, grade 4. As someone na nasa healthcare, dapat alam ko yun. Pero, siguro, I was really in denial at that time.
Sa kabila ng lahat ng iniisip at nararamdaman niya ng mga sandaling iyon, pagkwestiyon sa may kapal ang bumalot sa kanyang isipan.
Pero ang una ko po kasing initial na ginawa is, nag-message po ako sa mga trusted people ko. And actually, yung message ko po is, hindi para ipaalam sa kanila, kundi tinatanong ko, mga mentors ko po, tinatanong ko na, ba't to sa akin nangyari? Masama ba akong tao? So, halo-halo pinaramdam ko, nag-worry ako. Parang nagagalit po ako. Kasi, bakit? Parang, financially, sobrang hirap po para sa amin.
Wala akong masabi, pero kasi ang nasa isip ko, sabi ko, bakit sabi ko, Lord, bakit kaya, ako na lang kaya, kasi sabi ko, I'm old enough, alam mo yun, matanda na ako, yung anak ko, pumaga, nag-start pa lang sa life niya, marami pa siyang pangarap, ako na lang, so ganun lang nasa isip ko lang, hindi ko sinasabi.
Dahil hindi klaro kay Den ang dapat na gawin, kumonsulta siya sa 6 na doktor at isa lang sa kanila ang talagang nakapagbigay ng linaw sa dapat niyang gawin upang malampasan ang matinding hamon na ito.
Sa first meeting ko pa lang po kay Doc Pasa, grabe, sobrang inelaborate niya yung explanation sa akin. So, somehow dun po ako nagkaroon ng na yung doktor na kaharap ko, alam niya yung kung paano to, kung anong gagawin.
Dahil sa takot ni Den sa gagastusin, nagpasya siya na sabihan si Dr. Basa na hindi na niya itutuloy ang kanyang pagpapagamot.
Isa po sa mga treatment plan na inano po sa kanya Dr. Basa is surgery. May isa pa siyang option which is yung Healthway. So din yung first ko na nalaman po yung Healthway.
Muling kinabahan ang mag-ina nang sila'y pumunta sa Healthway Cancer Care Hospital.
Nagulat po kami sa place. Kasi very high-end yung hospital. Natakot po kami.
Kinabahan kami.
Kinabahan po
Wait
kami.
lang, naku baka.
Na baka
Sobrang mahal.
sobrang mahal. Pero actually, sa room pa lang po nagulat na po kami na mas affordable po siya eh. thinking na ganun po yung place, tapos private po siya. Pati sa ward nila, parang hindi ward. Ganun, parang hindi ward yung yung sa hospital. Tapos, pagpasok pa lang namin, sobrang accommodating na po. We don't usually experience that sa hospital.
Dagdag pa ni Denise, minsan ay naramdaman niya bilang isang pasyente, nakadepende sa pananamit at estado sa buhay kung paano ka tinatrato sa ospital.
Pero sa Healthway, grabe yung na iba yung as someone na nag-go through sa emotional, physical, mental, even spiritual struggle. Yung Healthway became a safe space talaga po.
Our operating room
Dr. Rami Rojas emphasized that the hospital is fully equipped for comprehensive cancer treatment. But he quickly pointed out that it's not just about the equipment.
So our departments are focused on cancer. We have departments that you won't find in other general hospitals. We have a department of hematologic oncology for Hema-Onco. That's the first department of its kind in the country. A department of medical oncology for our medical oncologists. But we also have a very unique department called the Department of Quality of Life.
HCCH Quality of Life head Dr. Joey Hoson says quality of life is crucial for patients as cancer diagnosis is very difficult to accept. It's not just about treatment, it's about understanding each patient's preferences and prioritizing their overall well-being.
So we envision the quality of life of our patients in terms of looking at them not as the disease. No? We look at them as a person. So our approach is actually holistic. We look into the physical, the psychosocial, even spiritual. So those are the aspects of care that we cater.
The Quality of Life team usually addresses the patient's questions on nutrition, lifestyle, spiritual, and emotional concerns.
So once a person is being heard of what's important to them, it feels like it adds to their healing in terms of their cancer journey. And it's actually the care that we want beyond cure.
At HCCH, the Quality of Life team ensures care goes beyond the patients themselves. The team is also dedicated to supporting the mental and emotional well-being of families and caregivers, guiding them on how to cope, stay resilient, and care for their loved ones during and even beyond the period of treatment.
It's one important service that we want to give to our patients and their families because they don't know who to go to. They don't know what's proper, so they have to have some guidance or a life coach that will help them understand what they're going through and support them.
Dr. Hoson adds that even at home, HCCH guides the patient's families and caregivers on how to best care for the patient during the most difficult stages of the illness.
The psychological toll, both for the patients and the family, is our focus, no? To be able to look at them holistically and address a patient having a journey for their cancer.
Dr. Hoson shares that palliative care often scares patients and their families.
We have this program that follows them up and look into their psychosocial worries, anything that they want to talk about, and just make them feel that they have somebody to journey with them in their cancer illness.
Dr. Rami Rojas added that even after the treatment is completed and the immediate goals are achieved, the patients need to make some changes in their lifestyle. To support this, HCCH has implemented survivorship programs to guide patients in the next phase of their journey.
Thank you.
We call it surveillance. We have to watch to see and try to prevent the cancer from coming back. Because we want them to live normal lives. That's the whole purpose of the treatments.
Patients like Dan are grateful for the experience they had in Healthway Cancer Care Hospital.
So, throughout the surgery preparations, grabe po yung care ng mga nurses. First ko po nakakita ng ganun. Tapos pati mga doctors pag i-visit ka. Parang meron talaga silang time mag-explain, i-comfort ka, really prepare you emotionally, mentally, dun sa gagawing surgery.
Bilang magulang, taos-pusong nagpapasalamat si Mami Irma na natagpuan nila ang ospital na tunay na makakatulong sa kanilang mag-ina.
Sa Healthway, na first time ko din na-experience yung hospital na sobrang napaka-accommodating nila. Pag tinanong mo, ay ma'am, dito sasamahan ka pa nila. So parang hindi ka talaga naligaw, parang feel at home.
Yung treatment na naranasan ko na-experience ko sa Healthway, doon ko na-realize na yung treatment is not just medical, not just physical. It's more on, sa akin po lalo na as someone na talagang nag-go through doon, more on emotional and spiritual. Kasi sobrang din po they connect with you. They made you feel na nakikare sila. Sobra po akong thankful sa Diyos because He really placed people and that place, yung Healthway, He provided that place for me para makayanan ko po ito. Kahit papaano ma-at-ease ako, kahit ang dami kong worries.
So if an individual purchases a BYD limited edition car, so part of the proceeds from that will go to the Cancer Care Hope Fund.
The pledge isn't a financial pledge. It's simply a commitment to create awareness within the organization.
For thousands of Filipino families, the biggest barrier to cancer care isn't just access, it's affordability. That's why AC Health recently launched the Healthway Foundation. It's a nonprofit arm dedicated to providing medical and financial support to underserved communities. According to Chiki Batak, Healthway Foundation's executive director, 40% of cancer patients and their families experience extreme financial stress while dealing with the illness, sometimes forcing them to sell their homes and properties, exhausting every possible means just to complete cancer treatment.
The banner program is the Cancer Care Hope Fund. So it is a mechanism for more Filipinos to have access to care. So we are doing a fundraising for it so that we can help as many as we can.
Batak shares that the goal of the foundation is to reach out to patients, regardless of gender, age, type, or stage of cancer.
You can apply for a grant by showing your financial situation at the moment. So we have medical social workers who assess also the case of a patient.
Through the Hope Fund, patients may receive support in 4 ways: assistance on the hospital bills, treatments, diagnostics and lab tests, and even medicines. Batak explains that while the subsidy cannot cover the full cost, it aims to ease the financial burden of patients and their families.
The usual 1-year cost for treatment is about 1 million to 1.5 million pesos. For the Hope Fund, if there are those who are in the monitoring or recovery phase and they discover something that needs to be addressed and they need assistance, they can actually still apply and see, and we will assess if we can proceed to assist them.
Partnerships fuel this mission. Even innovation finds a way to support a cause. Through AC Mobility's BYD Cars Philippines.
We have a partnership with BYD. So if an individual purchases a BYD limited edition car, so part of the proceeds from that will go to the Cancer Care Hope Fund. So in return, the buyer also gets a special package from the Cancer Care Hospital, which has vouchers for women's health screening, for executive checkups and immunizations.
Batak also points out that beyond patient care, the foundation also focuses on research, training, and community outreach. Through partnerships that promote awareness and early screening, the foundation hopes to change cancer stories, from despair to hope, giving more Filipinos a fighting chance and access to the best care possible. Most patients like Lexter and then continue working while battling cancer. Through the Working with Cancer Pledge, HCCH and AC Health, in partnership with Publicis Group and PMAP, are helping erase the stigma that cancer patients can't be productive, ensuring employees with cancer can get the support they need. Publicis Group Chief Digital Officer Dave Rilon shares that the company's Working with Cancer Pledge began during the pandemic, when their chairman, Arthur Sedun, was diagnosed with cancer. And through his own journey of recovery, Sedun discovered how unprepared many companies were in supporting employees with the disease.
He decided he would launch an advocacy called Working with Cancer, which is really meant to convince companies, not just in Paris, but all over the world, to create awareness and to consider creating special programs to help employees with cancer or employees who are taking care of somebody who has cancer in the family.
Dave stresses that bringing a program like Working with Cancer to a country such as the Philippines was actually a challenge.
In the Philippines, right, we don't like to talk about cancer. When people get sick, they normally say keep it private. If you get sick at work, typically you don't tell your office mates. You don't even tell HR. Many of them will probably tell you that they're afraid of losing their jobs. And that's actually what happens now, or that's what used to happen.
In one day. So this is a big...
Mr. Drilon emphasized that awareness is a pressing challenge. Too many people remain unaware of the laws that protect them, and even less informed about cancer itself, thus underscoring the urgent need for education and advocacy.
The pledge isn't a financial pledge. It's simply a commitment to create awareness within the organization.
Healthway Cancer Care Hospital's head of strategy and transformation, Dr. K. Recto, says once business leaders support the campaign, HCCH can help turn that commitment into action.
Whether they need help around awareness, around screening, right? Building programs that are specific to top cancers, for example, right? Or just being able to facilitate referrals that their patients or their employees might already need. That's really where we come in and assist.
Dr. Recto added that HCCH works closely with business leaders, including CEOs, CFOs, and human resources teams, to bring cancer programs to life. Companies can also make their pledge easily through a simple website.
So as of now, we've already had, I think, over 17 companies already sign up, and that's spanning siguro mga 70,000 employees already benefiting, I guess, from a company that has signed up for Working with Cancer.
Dr. Rector shares that they are deeply inspired to work harder when companies begin announcing their own cancer programs, seeing how these initiatives uplift employees' morale. From the challenges of diagnosis to the triumphs of recovery, Healthway Cancer Care Hospital and the Healthway Foundation are redefining what it means to fight against cancer in the Philippines. With world-class human-centric care, holistic support, and a community that stands together, every patient is reminded that you are not alone, and there is hope. I am Maricar Bautista, reminding everyone that we can always make a difference and pay it forward.